Hello, everyone. My name is Mathew, and today I will be talking about the global impact of addressing refractive errors in children through AI. But first, allow me to introduce myself. I am a rising senior at Northwood High School in California. Some of the activities that I'm involved in is Bharatanatyam dancing, and I'm a part of my school's debate team, and I've done medical research on immunotherapy for children with leukemia. However, today I will be discussing the global prevalence of refractive errors, first diving into what a refractive error actually is, then relating the disease to global health, and finally explaining how one can use AI in the diagnosis and treatment of this disease. Refractive errors are a common vision problem where the eye is unable to clearly focus images, resulting in blurred vision. The three common types that I will be focusing on are myopia, hyperopia, and astigmatism. But first, let's see what happens when the light ray enters a normal eye. With the normal eye, the light ray enters through the pupil and passes through the lens, allowing the ray to focus on the retina, which collects the information it needs and sends it to the brain for interpretation. However, for myopia or nearsightedness, the distance between the cornea and the retina is too long, so the light rays focus in front of the retina, as shown by the blue dot. This results in distant objects being blurry, while near objects are still clear. For hyperopia or farsightedness, the distance between the cornea and the retina is too short, so the light rays focus behind the retina, as shown by the blue dot again. This results in near objects being blurry, while distant objects are clear. Astigmatism is when the light rays focus on several points because the cornea is more curved in a certain direction. Since the light rays can focus in front and or behind the retina, the image is distorted and perceived as blurry. Due to the curvature, the eye is irregularly shaped, kind of like a football rather than a basketball, and both the visibility of near and distant objects can be affected. While these conditions might seem straightforward, their implications are far-reaching. Refractive errors are the leading cause of vision impairment that affects 2 billion of our population and hundreds of millions of children. If left uncorrected, these errors significantly impact a child's daily life, from education to employment to overall quality of life. This brings us to the broader perspective, how these individuals' health issues fit into the larger framework of global health. Global health is defined as a field of study, research, and practice that places a priority on achieving equity in health for all people. It focuses on addressing health disparities and ensuring that everyone, regardless of where they live or their economic status, has access to the care that they need. Refractive errors are a prime example of a health issue that requires global health solutions, as disparities in access to eye care services can lead to significant inequalities in health outcomes. These disparities in access to eye care services are driven, one, by poverty. Poverty is often related with poor food quality, insufficient food intake, leading to malnutrition, especially in children. Inadequate nutrition in a child's diet may prevent them from receiving the proper vitamins that support a healthy eye. For example, vitamin A is necessary for the production of red blood cells, and vitamin C and E help protect those blood cells from being prematurely destroyed. Nutrient deficiencies can also expose children to anemia, which causes retinal vessel abnormalities and can impair one's vision. These conditions highlight the critical need to ensure equitable access to eye care for all, especially when uncorrected refractive errors are responsible for 42% of the visual impairment cases worldwide. Both of these tables illustrate a prevalence of myopia, hyperopia, and astigmatism in children and adults based on different regions. Looking mainly at the data for children, some important trends to notice is that the Southeast Asia region had the highest prevalence of myopia, while the Eastern Mediterranean region had the lowest prevalence. The highest rates of hyperopia in children were in Nigeria and in the US, and the highest rates of astigmatism in children was in Singapore. Some may assume that lower or middle income countries would automatically have higher rates of refractive errors, but the reality is poverty plagues every country, and the implications of the disease are detrimental in every country, regardless of if it's considered a developing country or not. Especially for children, uncorrected refractive errors can create serious health issues. Early onset vision impairment can reduce a child's productivity through delayed cognitive development. And for school-age children, the inability to read standard-sized print, The text on a computer or distinguished color can have detrimental impacts on their education when left uncorrected. Additionally, a child's family can experience a serious economic impact, especially when in poverty, which can leave the child and their family with a financial burden, no access to affordable care solutions, which ultimately creates a disparity in their ability to access eye care for their young children. Because the impact of refractive errors are so threatening for children, especially, it is important to secure universal access to eye care, regardless of their location or income. Fortunately, artificial intelligence-driven tools are transforming telehealth and optometry. It is more efficient and accurate, and optometrists can provide remote consultations and use virtual screening platforms powered by artificial intelligence. This helps improve access to diagnosis and treatment, even in the most remote locations. When using telemedicine for retinal care, artificial intelligence is used to analyze images of the eyes and spot signs for disease. A discussion paper from the Canadian Association of Optometrists explains how this technology can be used in Canadian rural and remote areas with the shortage of clinicians. These examples highlight the potential of AI to address health disparities in eye care, especially among the youth. Now, how can we take meaningful steps towards achieving global health equity? First, we can raise awareness to educate others about the connections between poverty, nutrition, and eye health. We can also volunteer for and donate to organizations like New Eyes and Sight for Students that help provide affordable eye care services and glasses to underdeserved communities. For us, finding these organizations can be as easy and as simple as just a Google search, but for those we help, the impact is truly enormous. We can also use our voices to help shape policies that ensure equitable eye care for all, and to encourage the use of telemedicine and AI-powered solutions to expand the access to eye care in remote areas and undeserved areas. We can support innovative solutions to help bridge the gap in healthcare access. Getting involved is crucial because with our vision, we have the power to help others see a brighter future. These are the citations of the sources I used, and feel free to email me with any questions you may have. Thank you so much for listening.